Have you ever just felt totally lost trying to figure out what you should be eating? Especially, during a big life change like pregnancy, it feels like there's just so much information flying around. It can be really overwhelming. So today we're doing a deep dive into, well, the really fascinating and vital world of nutrition during childbearing. This isn't just like general health advice. It's super specific, really impactful stuff about nourishing new life and yourself.
Yeah, and all our insights today, they're coming straight from a pretty comprehensive nursing ebook chapter, one that focuses specifically on maternal, newborn, and women's health. So it's packed with solid, evidence-based knowledge. And our mission really is to cut through all that noise. We want to pull out the key facts and help you quickly get a handle on what good nutrition actually looks like for both the expectant parent and the baby, and importantly, even after the baby arrives. Because, well, our sources really hammer this home. Nutrition is probably never more important in a person's life than during pregnancy and lactation. Okay, so now that we've set the stage a bit, let's jump into the first big topic.
It's one that gets a lot of attention, sometimes even causes a bit of anxiety, weight gain during pregnancy. And the thing is, it's so much more than just a number on the scale, right? It has profound effects on health for both.
Exactly. Yeah, our sources really emphasize that. Gaining too little weight, that's a problem. Gaining too much, also a problem. Both carry pretty significant risks. So, for instance, not gaining enough weight, that's linked pretty strongly with things like preterm birth.
Okay.
And babies being born small for gestational age, or SGA, as it's often called.
Right.
It can also, deplete the parent's own nutrient reserves, which means the fetus might not get enough essential building blocks. That could lead to inadequate nutrient stores in the baby, or even neural tube defects if folic acid intake is too low.
Wow.
And what's really striking is how common this is. The source mentions about 21% of people actually gain less weight than recommended.
1 in 5.
Basically.
That's quite a lot. So what about the other side, gaining too much?
Yeah, that's a major concern too. Excessive weight gain, according to the source, is linked to increased birth weight. So large-for-gestational-age infants, LGA,
Right.
sometimes called macrosomia, just means a significantly larger baby. But it also increases the risks for the parent, things like preeclampsia, gestational diabetes, and struggling with postpartum weight retention later on. And this is even more common. Around 48% gain more than recommended.
Almost half.
Yeah. So add those together. You're looking at nearly 70% of pregnancies involving either too little or too much weight gain.
That's staggering. 70%. It really shows how important getting that balance right is, but also how difficult it must be.
Absolutely. It highlights why that personalized guidance is so critical.
So, okay, what does this actually mean for you, the listener? You mentioned personalized guidance. Our sources give specific recommendations, right, based on pre-pregnancy BMI.
That's exactly right. BMI, your body mass index before pregnancy, is the key. It determines your target range. So whether you start out underweight, normal weight, overweight, or with obesity, the amount you're advised to gain is different. It's tailored.
Makes sense.
For example, someone starting underweight, BMI under 18.5, they'll generally be advised to gain more, maybe 28 to 40 pounds total. Someone in the normal weight range, BMI 18.5 to 24.9, the target is typically 25 to 35 pounds.
Okay.
Then for overweight, that's a BMI of 25 to 29.9. It's usually around 15 to 25 pounds. And for individuals starting with obesity, BMI 30 or higher, the recommendation is often 11 to 20 pounds.
Got it.
And the pattern matters too. It's generally a gradual, steady gain, not much in the first trimester, maybe 1 to 4.4 pounds a total. But then in the second and third trimesters, it's typically somewhere between, say, half a pound to just over a pound per week, depending on that starting BMI category.
That's really helpful detail, but it does sound like a bit of a tightrope walk. What about unique situations, like if someone's expecting twins or if the expectant parent is an adolescent?
Good question. Yes, the recommendations definitely shift. For twins or other multiples, the needed gain is significantly higher, often in the range of 37 to 54 pounds for twins.
Wow. Okay.
And for adolescents, well, usually the adult BMI categories are still the starting point for recommendations. But we also have to remember they're still growing themselves.
Right, to old demands.
Exactly. But the key point, really, across all these situations is that gradual, consistent pattern of gain. No sudden jumps or drops, just steady, supportive weight increase.
Okay, so we've covered the how much weight gain. Now let's really unpack the what. What specific nutrients are needed? It's amazing how the body ramps things up to nourish too.
It really is incredible. The demand for, well, almost all nutrients goes up significantly during pregnancy. take energy, calories. It's not a massive jump right at the start. Usually no extra calories needed in the first trimester.
Oh, interesting.
But then, yeah, it increases by about 340 extra kilocalories a day in the second trimester.
Right.
And around 450 extra kilocalories a day in the third. If you look at the whole pregnancy, it adds up to needing roughly 80,000 additional calories overall.
80,000. That puts it in perspective.
Doesn't it? And then macronutrients. Protein needs jump quite a bit. The recommendation goes up significantly for pregnant individuals. Complex carbs are super important for energy and fiber.
Mm-hmm.
And essential fatty acids, like DHA, are absolutely critical for the baby's brain and eye development. Think fatty fish.
Right. And the micronutrients, the vitamins and minerals. I know some are really emphasized.
Oh, definitely. Folic acid is probably top of the list. It's
Yeah.
just so fundamentally important. We're talking about preventing serious birth defects like spina bifida, anencephaly, these neural tube defects.
And the timing is key there, right? Even before conception.
Exactly. Ideally, at least 1 month before conception and definitely through that crucial first trimester. The general recommendation is 600 micrograms, that's 0.6 milligrams, daily for women of childbearing age. But if there's a history of neural tube defects, the dose needs to be much higher, 4 milligrams or 4,000 micrograms daily.
Okay, that's a huge difference. Good to know. What about iron?
Iron is another big one, absolutely essential. It's needed to carry oxygen for you and, crucially, for the baby. The requirement bumps up to 27 milligrams daily during pregnancy. That's compared to 18 milligrams for non-pregnant women.
And absorption is a factor too, isn't it?
Yes, very much so. There's heme iron from animal sources, which is absorbed pretty easily, and non-heme iron from plants. For the non-heme iron, you really want to pair it with vitamin C to boost absorption.
Like oranges with spinach.
Exactly. And maybe avoid having coffee, tea, or milk right with your iron-rich meal because they can interfere with absorption. And here's a key point from the source. The baby builds up most of its iron stores in the last 4 to 6 weeks of pregnancy. So your intake towards the end is really vital for them.
Fascinating. Okay, what else? Calcium.
Calcium, definitely. Crucial for bone development for both of you. The recommendation is 1,000 milligrams a day. You can get that from dairy like yogurt, milk, cheese, but also fortified orange juice, broccoli, even pinto beans and tofu. Lots of options.
Good.
And one more to mention is choline. Maybe less talked about, but important for fetal brain and spinal cord development. Found in things like eggs, meat, seafood, and those cruciferous veggies, broccoli, cauliflower, cabbage.
Okay, wow. That is a lot of specific needs to keep track of. Which brings up a really practical question. How do you actually get all these extra nutrients without just feeling like you have to eat constantly or eat way too much?
Yeah, that's where the concept of nutrient density becomes so important.
Nutrient density, explain that a bit more.
Sure. It basically means choosing foods that pack a lot of nutrients, vitamins, minerals, protein, fiber, into relatively fewer calories.
Yeah.
It's the opposite of empty calories, like you find in sugary drinks or highly processed snacks that offer calories but very little nutritional value.
Right, so quality over just quantity.
Precisely. By focusing on nutrient-dense foods, fruits, vegetables, whole grains, lean proteins, dairy, you can meet those increased needs much more effectively without over-consuming calories. This helps with managing that healthy weight gain we talked about and ensures the baby gets all the crucial building blocks.
That makes a lot of sense. Nutrient density, focusing on the quality.
Yeah.
But, practically speaking, that could be tough, right?
Yep.
Especially if you're feeling tired or nauseous. And given all these increased needs, are supplements like prenatal vitamins the simple answer?
That's a really good point. Yeah, making those shifts isn't always easy day to day. Simple swaps can help, like whole grain bread instead of white or water instead of soda.
Yeah.
And yes, prenatal vitamin mineral supplements are very commonly prescribed for a reason. They act as a sort of nutritional insurance policy.
Okay.
They can definitely help fill gaps, especially for key nutrients like folic acid and iron, which can be hard to get enough of from diet alone sometimes. But, and this is important, food should always be the primary source. Supplements are meant to supplement, not replace, a healthy diet.
Right. Not a magic bullet.
Exactly. And you also need to be cautious. More isn't always better. Taking excessive amounts of certain vitamins, particularly fat-soluble ones like vitamin A, can actually be harmful. It can potentially lead to toxicity and even fetal anomalies. So always stick to the prescribed dose.
Good warning. Okay, this is all fascinating. And it really strikes me how nutrition isn't just about what's on your plate. There are so many other things that influence it, right?
Oh, absolutely. It's a much bigger picture. Age is a factor we touched on, adolescents, for instance. They often face higher risks, partly because their eating habits might be less consistent, maybe sleeping meals, more fast food. Plus, they have those dual needs for their own growth and the pregnancy.
Yeah.
They particularly need to focus on getting enough iron, calcium, folic acid, and zinc.
And culture.
Yeah.
That must play a huge role.
A massive role. Cultural beliefs, traditions, food preferences, they really shape dietary choices, what people eat, what they avoid. Sometimes certain foods are considered hot or cold and avoided during pregnancy in some cultures. It's not necessarily about nutritional value, but belief.
Right.
So understanding and respecting those cultural contexts is absolutely vital. If you're providing nutritional advice, it has to work within their framework.
Makes sense. What about socioeconomic factors?
Yeah, that's a big one too. Poverty, unfortunately, is often linked to nutrient deficiencies simply due to cost and access. Healthy, nutrient-dense foods can be more expensive or harder to find in some areas. It makes meeting those increased pregnancy needs really challenging for some people.
It's this important context.
Yeah.
Okay, let's shift gears slightly and unpack some of the common sort of nutritional challenges people might actually face during pregnancy.
Definitely. There are several common ones highlighted in our source material. Nausea and vomiting morning sickness, though it can happen anytime, is really common, especially early on.
Ugh, yeah. That sounds rough for trying to eat well.
It is. The advice usually involves small, frequent meals rather than large ones. Eating dry toast or crackers before getting out of bed. Sometimes ginger tea can help settle the stomach.
Okay. What else? I've heard of something called pica.
Yes, pica. It's a craving for things that aren't food, like ice, dirt, clay, laundry starch.
Really? Dirt?
Yeah. It sounds strange, but our source connects it strongly with iron deficiency anemia. It's like the body is desperately seeking something. But the irony is, eating these non-food items can actually interfere with absorbing the nutrients you do eat.
Wow. So it's a sign of a problem and it makes the problem worse.
Exactly. Then there are eating disorders. These are obviously very serious mental health conditions, and during pregnancy, they require really close medical supervision. They pose significant risks for both the parent and the developing baby. Compassionate, specialized support is key.
Absolutely. And what about things like caffeine or alcohol?
Right. Substance use is a major factor. Smoking, alcohol, illicit drugs, they can all interfere with nutrient absorption and directly harm fetal development. The advice on alcohol and drugs is complete avoidance, just not worth the risk.
Mm-hmm.
For caffeine, the general guideline mentioned is limiting intake to about 200-300 milligrams per day. That's roughly 2 to 3 standard cups of coffee.
Good to have a number. What about specific diets like vegetarian or vegan?
Yeah, that's another important consideration. It's absolutely possible to have a healthy vegetarian or vegan pregnancy, but it does require careful planning. Potential nutrients of concern might be complete proteins, vitamin B12, which is mainly in animal products, vitamin D, iron, zinc, iodine, and those omega-3 fatty acids like DHA.
So careful meal planning, maybe specific supplements are needed?
Often, yes. Careful planning and possibly targeted supplementation to make sure all needs are met. And one more specific group, individuals who've had bariatric surgery. They're at higher risk for nutrient deficiencies due to changes in absorption, so they need comprehensive evaluation and usually lifelong supplementation, which becomes even more critical during pregnancy.
Okay, lots of potential challenges there. So what happens after the baby arrives? Does everything just go back to normal, nutritionally speaking?
Not quite. The nutritional journey definitely continues, especially for those who are breastfeeding.
Right, because you're still nourishing the baby.
Exactly. Lactating parents actually have even higher energy needs initially than during late pregnancy. The recommendation is about 500 extra kilocalories per day for the first 6 months of breastfeeding.
Wow, 500.
Yeah. Then it drops slightly to about 400 extra calories per day after 6 months. Fluid intake is also really important, aiming for about 8 to 10 cups of fluids daily. And protein needs stay elevated, similar to pregnancy levels.
Okay, and for parents who aren't breastfeeding?
For non-lactating parents, the advice is generally to return towards their pre-pregnancy dietary patterns, but still focusing on healthy eating, replenishing any depleted nutrient stores, and, gradual healthy weight management.
Which brings us to postpartum weight loss.
Yeah.
That's often on people's minds.
Understandably. The expectation should be for gradual loss, maybe around 1 to 1.5 pounds per week is considered a healthy rate. And interestingly, breastfeeding can actually help with this. That extra energy expenditure required for milk production can contribute to postpartum weight loss.
A nice little bonus, perhaps.
It can be, though everyone's body and experience is different, of course.
Absolutely. Okay, so we've covered a ton of ground. If we try to bring this all together, how can someone listening apply all this knowledge, make it practical?
Well, a really good starting point, often done with a healthcare provider, is some kind of nutritional assessment, like looking at your typical diet history or using a food frequency questionnaire. That helps tailor the advice.
Makes sense. Personalize it.
Exactly. And then food safety becomes absolutely paramount during pregnancy and lactation. We have to be extra careful. Our source material is really clear on avoiding fish known to be high in mercury shark, swordfish, king mackerel, big eye tuna.
Okay.
Lower mercury fish are okay, but limit them to about 12 ounces per week total. And crucially, avoid unpasteurized milk, juices, or soft cheeses. Also, raw or undercooked meat, poultry, eggs, and seafood. And be cautious with deli meats or hot dogs unless they're reheated until steaming hot. This is all to prevent foodborne illnesses like listeriosis, which can be really dangerous during pregnancy.
Super important reminders. And just general dietary advice.
General advice really circles back to those core principles of healthy eating. Things like the My Plate model can be a helpful visual guide. Aim for lots of colorful fruits and vegetables, whole grains, lean protein sources, dairy or calcium-fortified alternatives, and always keeping that concept of nutrient density in mind, getting the most nutritional bang for your caloric buck.
Nutrient density. That seems like a key takeaway. Okay, this raises, I think, a final important question for you, our listener, to really think about.
Yeah, maybe consider this. How does understanding the why behind all these nutritional recommendations, not just memorizing the what, actually empower you? How does knowing why folic acid is crucial before conception or why iron needs increase so much help you make choices that feel truly informed and right for you? And think about how that deeper understanding isn't just for this specific period of childbearing. How can that knowledge become a foundation for your own long-term health and maybe even ripple outwards, influencing the health habits of your entire family?